We are back here on Girl Talk, and I'm really excited. We have a member of the Hilton Head Hospital with us. Diane is here, and she is in charge of the emergency department. It's National Nurses Week. Lots of wonderful things are happening. And it's a time, we were talking at the beginning of the segment, where, to me, a lot of wonderful things have been happening in the past 7 weeks. Yes, we have a virus, but it's also given us all a chance, I think, to pay attention to our health and our wellness and our safety. And we've actually had a lot of fun talking before we even started. And one of the things that you were excited to share, I think, is a little bit about coming to the emergency department. What can we expect? And how to kind of de-stress people.
Sure.
And make them not so afraid to come.
Absolutely. And we were all very anxious when this started weeks ago, and including the healthcare workers. I mean, we were afraid for our personal safety and the safety of our families. So in the beginning, we focused a lot on making sure we had enough supplies, whether it's the PPE or just the regular medical equipment, would we be able to get our supplies in? And we also focused a lot on training our staff. We did a lot of cross-training of our nurses to be able to flex them to other units if need be, but just to make sure that everybody was prepared.
It was really interesting because we had Dr. Snowman on, and he was saying that you all were education, that actually there was a lull, so you had extra time, and that's what you did with that time. You cross-trained, you educated, you coordinated.
We did exactly that. Nurses from the OR went to work on the floor. Nurses from the floor came to the ER. People learned about new equipment. So everyone would be prepared, and we would have that flexibility when the surge came, that we'd be able to care for everyone. We also now have switched a little bit because we feel really good about our supplies and our PPE, that we've switched now to, okay, how do we make sure everybody knows that it's safe to come to the emergency room again?
Yes, okay.
Because there was a lot of questions about that, and we get phone calls every day from patients calling saying, I feel like I need to come, but is it safe? Am I going to be safe when I get there? So now that we've switched gears, we're focusing on 4 aspects: testing, screening, spacing, and cleaning.
Okay, so do them again.
Testing.
Okay, which means what?
So if you need to be tested, now there's a plethora of tests available. So we don't have to be as strict as we were weeks ago about who's getting a test for the coronavirus.
Okay.
So we have plenty of tests available.
Okay.
Then we're screening. So we're screening our employees every day when they come in. We have our temperature taken, and we're giving a mask at the door. We're also screening our patients when they come in, whether it's for an elective procedure now that we're doing more of those again, a diagnostic procedure. So if your physician's sending you over for your mammogram, you're getting screened for that. And we're also screening emergency room patients when they come in. So everyone is given a mask.
So testing, screening.
Then spacing. So we've done a lot with the social distancing. So when you come in, you'll notice in the registration areas, there's stickers on the floor indicating where you should stand to wait in line if need be. We've rearranged a lot of our waiting rooms and taken out a lot of our chairs. They look a little barren right now, but we want people to feel comfortable if they're having to wait for a few minutes. So
function over form now.
There you go. So we've done that in our radiology department, and our emergency department. Out at the Bluffton Medical Center, they are doing the same kinds of things out there. And then cleaning. So the big focus is on cleaning afterwards. So our environmental services people are phenomenal. They are assisting us. We've got nursing staff, and as well as other departments that are taking an extra interest in making sure their departments are wiped down regularly. The waiting rooms are wiped down as needed, so everybody can feel good about it being clean as well.
Is it still really about hand washing? Is that what we're looking at, also being safe? Wash those hands.
It is. It's that old saying, wash your hands.
Yeah, I mean, it really goes back to the same lifestyle things that we were taught years and years ago. I really, again, thank you for being on the front line. Thank you for doing all of this. I think many of us are so grateful for you.
Thank you.
And it's kind of nice probably have a little praise every now and then.
It's always good to hear good things.
It is. Thank you so much. Stay with us. There's more to come here on Girl Talk again.